Hi everyone, welcome back. It's Amy and it's Sunday. So it must be time to talk about STDs, right? STDs are something we can agree nobody likes, nobody wants. They're super easy to prevent, that I can tell you. On top of being a big pain and a nuisance, some STDs have no cure. Some STDs start out with very few symptoms. Some STDs will start out with no symptoms at all. Some STDs, if they go untreated, can cause permanent, irreversible damage. All right, so let's start out. We'll do these kind of in an alphabetical order. Let's start out talking about AIDS. AIDS stands for Acquired Immune Deficiency Syndrome. A myth about AIDS is that people die from AIDS. They do not die from AIDS. They die from the HIV virus, or they die from associated secondary illnesses or cancers. AIDS is not caused by being homosexual. Newsflash. Can you believe that there are people who roam the earth who actually still believe that? You can have the HIV virus without ever getting AIDS. You cannot get AIDS from casual contact. You would think people knew this by now, but apparently they do not. The virus attacks the immune system, and presently there is no cure. That being said, due to medical advancements, you can live a full and happy life with HIV. What if you have a cut? You have a cut on your arm, I've got a cut on my arm, and you've got HIV, and those two cuts touch each other. Am I going to get HIV? No, I'm not. What if you have HIV and you bite me? What if you bite me? Am I going to get HIV? No. You would have to bite me and hold your mouth over that cut like a vacuum for me to even have a chance of getting HIV. Once, although the transfer is through body fluids, that is not a way it's going to pass. Once the blood hits the air, it kills the virus. Infected women, they can pass HIV on to their unborn child. However, if they stay on their medication or their cocktail regimen, they have a less than 1% chance of passing on HIV to their unborn infant. All right. Wear a condom. Wear a condom. Wear a condom responsibly. Wear a condom with spermicide. Look, I understand they aren't 100% safe. They tear, they break, they can have a hole in them if you've had them in your pocket for a long time. HIV starts out like you have nothing more than a bad cold. Swollen glands, fever, etc. All right? You have been warned. All right, bacterial vaginosis. This is something that women get. We have no idea how they get it. It might be from douching. All right? If you have a gray discharge or a fishy odor, a burning, an itching, some women have no symptoms. The fishy odor is more pronounced during intercourse. This is much more common than you'd think, and it can be cured with antibiotics. Men have no treatment if they come in contact. Cancroid, these are genital ulcers. Depending on where the ulcer is, you might have painful urination, you might have defecation pain, rectal bleeding, painful intercourse, vaginal discharge. You will see ulcers in about 4 to 7 days after contact, and they can persist for years if they go untreated. You and your partner will both need antibiotics, and there should be no sex until everything's cleared up. That's with most of these that can be cured by antibiotics. You should wait until all your symptoms are gone before you resume sex. Use condoms. I'm going to just keep saying that. Use condoms, use condoms, use condoms. All right, chlamydia. This is the most prevalent STD, especially with people from age 15 to 25. It is another bacterial infection. Sometimes you will have no symptoms. Some men and women will get a discharge. Women may have painful urination. They may have itching. They may have pelvic pain and bleeding, but oftentimes there are no symptoms. It can be very serious. If it goes untreated, it can cause sterility. 100,000 people a year become sterile from chlamydia. Men can get arthritis and inflamed testicles. Women can get a cervical infection and PID, or pelvic inflammatory disease, which can cause sterility. This is very serious stuff. It can be passed on to an infant while you are giving birth. You have to tell your partner if you have chlamydia, because it can be cured with a simple antibiotic. Because women especially show no symptoms, if you are sexually active, you should be tested for chlamydia yearly. Wear a damn condom. All right. Gonorrhea, another bacterial infection. If genitals touch, even without intercourse, you can spread gonorrhea. Sometimes you will go 2 to 9 days with no symptoms, and then you'll get a discharge. You may get painful urination, a sore throat, but like chlamydia, often there are no symptoms. It can cause sterility and arthritis if it goes untreated. Again, like chlamydia, women can get pelvic inflammatory disease, or PID. It will not go away by itself. If your eyes get infected, it can cause blindness. This is very serious stuff. Pay attention. Some strains of gonorrhea are very resistant to antibiotics. Both partners will need to be treated. All right, hepatitis B, or Hep B. This is a viral infection, which means it cannot be treated by an antibiotic, which also means there is no cure. There is a vaccine to help prevent that will prevent Hep B, and it is given to infants in 3 or 4 shots over a 6-month period of time. Hep B causes inflammation of the liver. You get it from exposure to body fluids, dirty needles, and through sexual contact. It may lead to chronic or fatal liver disease. It is very common, and it can take weeks or even months for you to fully recover when you've had some treatment. All right, herpes simplex virus 2. This is genital herpes, not to be confused with oral herpes, all right? These are painful blisters or sores that appear on the penis, the vulva, the anus, sometimes around the mouth. There is no cure, all right? It's in the title there. It's a virus. You can get some medical relief. It might go away, but it's going to come back, all right? You never get rid of it 100%. Even if you are on a regimen like Valtrex, which is an antiviral, and you haven't had an outbreak in 20 years, you are still shedding the virus, and you can pass the virus on to a partner. Having no outbreak is never an indication that you should not be wearing a condom. It is highly contagious. It can be passed through cuts, genital openings, or through the mouth. It can move from one part of the body to another if you touch an infected area. Ladies, stop sharing lipstick or lip balm. Even with oral herpes, you should not share. You share a lipstick and you pass the herpes. Then the woman gives oral sex to a partner. And there you go. If they have herpes 1 or 2, it'll show up now on their genitals, passed from lip balm, passed into your mouth, passed on to your partner. Try explaining that you got herpes from a lipstick. Would you believe somebody? All right, stop sharing. Nobody's going to believe you. So, if you have contact after about 2 or 20 days, you will see blisters on the penis, the vulva, inside the vagina where no one can see it, on the cervix, pubic area, thighs or buttocks. You're going to be achy. You're going to have swollen lymph nodes, fever like the flu. It can cause blindness in newborns. If you are pregnant and you have herpes, you will have to have a C-section. There are 500,000 to 1 million new cases of herpes a year, so some of you are not listening about wearing condoms or dental dams. All right, next time I will have part 2 of STDs, because one STD video just simply is not enough. All right, until next time, please subscribe to my channel. Feel free to get in touch with me on Facebook, on Instagram, on Twitter, or through this channel. And until next time, be well.